Hello there. If you or someone you care about is living with a stoma, you've probably heard about something called a parastomal hernia. It's super common, but it can also be a bit confusing. So this is your guide. We're going to break down what it is, why it happens, and what you can do about it, all in plain English.
All right, let's jump right in. We're going to walk through this whole journey together. First, we'll cover the basics. What exactly is a parastomal hernia? Then we'll get into the why, the risk factors. We'll talk about the big decision, to fix it or not to fix it. And if you do decide on a repair, we'll cover what to expect before, during, and even after the surgery. For most people, this is how it all starts. You're just going about your day, and you see or feel a new bulge around your stoma. And yeah, that can be pretty worrying. But the very first thing I want you to know is you are definitely not alone. This is a really common thing for people with an ostomy.
So what's actually happening when that bulge shows up? Let's get a really clear picture of what's going on under the skin.
Okay, so imagine your abdominal wall is like a strong sheet of fabric. To create your stoma, the surgeon made a small hole in that fabric so the intestine could come through. Well, over time, that little opening can start to stretch out and get weaker. When that happens, stuff from inside your abdomen, like more intestine or fatty tissue, can start to push through that weak spot, and that's the bulge you see. That's a parastomal hernia.
And when I say it's common, I mean really common. When you look at people long-term, studies show that more than half, more than 50% of all people with a stoma might end up developing one. It's so frequent that some doctors basically consider it an expected outcome for some folks.
Now, just having the bulge itself isn't always a problem, but it starts to matter when it causes issues like these. Maybe it's causing some pain or discomfort, or maybe the new shape around your stoma is making it a nightmare to get your pouch to stick, which then leads to leaks and irritated skin. For some people, it can even feel like things just aren't moving through the stoma the way they should. These are the kinds of symptoms that usually make someone say, okay, time to talk to my doctor.
So let's dig into the why. Why do these hernias happen in the first place? Understanding this can help us see who might be more at risk.
What's really interesting here is that it turns out not all stomas are created equal when it comes to hernia risk. You can see there's a pretty wide range, but the big takeaway is that end colostomies, well, they have the highest chance of forming a hernia. And on the flip side, loop ileostomies, which are often just temporary, have the lowest risk of all.
But it's not just about the type of stoma. Your own personal health plays a huge role. Basically, anything that puts extra pressure on that abdominal wall can up the risk. Things like being overweight, especially carrying extra weight around your middle, and other factors like your age or conditions like diabetes and smoking can affect how well your body's tissues heal and stay strong. And, emergency surgery often means the stoma had to be made in a hurry under less than perfect conditions. And to really drive this point home, a person's body shape is one of the biggest predictors we have. The research is pretty clear on this. Having a waistline over 100 centimeters, which is about 40 inches, is linked to a staggering 75% chance of developing a parastomal hernia. That's a huge number. Okay, so this brings us to a really important crossroads. If you have a hernia, do you absolutely have to get it fixed? Well, the answer isn't always yes, and this is where you and your doctor really become a team to figure out the best move for you.
There are really two main paths you can take here. If your hernia isn't really causing you much trouble, a lot of people choose what's called watchful waiting. That just means you keep an eye on it, maybe use support belts and find a pouching system that works, and you get to avoid the risks of surgery. Now, surgery is usually for when that hernia is causing real problems in your day-to-day life, like serious pain, blockages, or constant pouching failures. The goal of the surgery is to fix those problems, but you have to know it comes with its own set of risks, including the chance that the hernia could come back.
And here's the crucial point. If you and your doctor decide that surgery isn't the right move for you right now, you're actually in the majority. Up to 70% of people with a parastomal hernia don't have an operation, so living with it and managing the symptoms is a totally valid and very common choice.
But let's say surgery is the right path for you. Well, the great news is that there are things you can do beforehand to really stack the deck in your favor and get the best possible outcome.
Doctors call this pre-op optimization, but really, it's about you taking control. It's so empowering. By focusing on these three things, you become a real partner in your own success. Getting to a healthier weight puts less strain on the surgical repair. Getting your blood sugar under control helps your body heal. And quitting smoking, it dramatically boosts your body's ability to recover and fight off any infections.
When we talk about weight, there's usually a specific target.
To lower the risk of complications and to help make sure the hernia doesn't come back, surgeons typically want a patient's BMI, or body mass index, to be under 35 before they'll schedule this kind of elective surgery.
And for smoking, the timeline is also pretty clear. The science shows that if you can be completely smoke-free for at least 4 weeks before your surgery, you give your body the absolute best shot at healing up properly.
Okay, so you've done all the prep work and it's time for surgery. What's actually going to happen in the operating room? Let's break down the main ways these hernias are fixed.
First things first, just stitching the hole in the muscle closed doesn't work very well. I mean, those repairs fail a lot. We're talking up to 80% of the time. That's why today, the standard solution is to use a special surgical mesh to reinforce the area. It's kind of like putting a patch on a tire.
And there are a few ways to put that mesh patch in place, but the go-to procedure for most surgeons these days is a minimally invasive or laparoscopic repair. And the technique they use is named after the surgeon who came up with it. It's called the Sugar-Baker method.
And this is where it gets really clever. See, instead of cutting a hole in the mesh for the stoma to go through, the surgeon lays the mesh flat over the hernia hole. Then, they guide the intestine to the side so it comes out from underneath the edge of the mesh. This creates this amazing one-way valve effect. So when you cough or strain, the pressure inside your belly actually pushes the mesh tighter against your abdominal wall, which helps seal off the exit and stops the hernia from pushing back out. It's a brilliant design.
This chart right here shows you exactly why the Sugar-Baker has become the favorite. When you compare it to an older laparoscopic method called the keyhole technique, the difference is huge. The Sugar-Baker's recurrence rate is down around 10%, while the keyhole is way up at 28%. It's just a much, much stronger repair.
So, you've made it through the surgery. What's life like now? It's really important to have a realistic view of what the road ahead looks like.
You'll often hear experienced surgeons call this type of surgery a humbling endeavor. And this quote really explains why. Even though the surgery can make a huge difference in your symptoms and your quality of life, this is a tricky problem. Even with the best mesh and the best techniques, these hernias can come back over time. Some long-term studies show recurrence rates can still climb over 50%. And that's exactly why that initial decision to watch and wait is so important.
At the end of the day, managing a parastomal hernia is a totally personal journey. What's right for you depends on your symptoms, your health, and what's important to your quality of life. I really hope that with all this information, you feel more prepared and empowered to have a great conversation with your doctor and find the absolute best path forward for you. Thanks so much for tuning in.